Welcome back. Tonight, we are once again answering your COVID-19 questions. And joining us now, infectious diseases specialist Dr. Isaac Bogosh, who has recently been appointed by the province of Ontario to a team collecting and analyzing COVID-19 data. Though, Dr. Bogosh, that work is pretty in early stages right now.
Yeah, it absolutely is. But we're basically looking at getting all the right data housed in the right place so that policymakers and researchers can use this data to really help Ontario and hopefully the rest of Canada fight this pandemic.
Okay, well, we'll have to book some time later to talk more about that. But let's get to some of the questions that we've been getting for you. Here's one. Are health authorities expecting large outbreaks of COVID-19 in cities where protest marches took place this past week? And I guess that's cities in Canada and the U.S.
Yeah, certainly no one would be surprised if there was a spike in cases. We know that exacerbating factors might be some of the protests where we saw hundreds or even thousands of people clustered together closely. We saw some protests where people weren't wearing masks, and certainly we saw lots of yelling and shouting. And of course, in those settings, it would come to no surprise if infection was transmitted. There's other protests where we saw mitigating factors. I mean, all of these were outside, so being outside is extremely helpful. Some places we saw people spread apart, and we saw a high proportion of mask wearing in some protests as well. So in those settings, I think it would be much less likely for this infection to be transmitted.
Okay, so here's the crystal ball question. I mean, given all that, and given the pace of reopening, particularly here in this country, here's another question. What are the chances that COVID-19 will continue through the summer?
I think the chances are extraordinarily high. We know that there's very little immunity in the population. We know that there's a high burden of infection in many parts of the world, including South America, even the southern United States, South Asia. We're going to see a lot more COVID-19 throughout the summer. And I know that some people think that the warmer temperatures or the UV rays will help fight this off. But when we see such a high burden of infection globally, I don't think that climate and ultraviolet rays and high temperatures are really going to have much of a factor. If there's a far smaller burden of infection globally, it might play a part, but certainly not where we're at now. So I would expect to see a lot of COVID transmission throughout the summer months.
Okay, now you mentioned high temperatures, and here's an interesting twist on that. When we travel again and have temperature checks at travel locations, will a thermometer be able to distinguish fever from sweating or hot flashes?
Yeah, in general, it will. I mean, usually people who are, a little sweaty from walking through an airport, or people who are having hot flashes, don't actually mount a true fever, whereas people do mount a true fever in the context of some infection. So it most likely will be able to distinguish between most of those cases. Having said that, when we think about these temperature checks for the utility of detecting COVID-19, it's actually pretty poor. We know many people with COVID-19 infections will not have a fever. And for that to work, you have to have a fever at the right place, at the right time, detected with the right instrument. And in fact, this won't be very useful in detecting COVID-19 infections. A lot of this is optics, unfortunately, but they may catch a case now and again, but it's really not the most effective way to detect cases of COVID-19.
All right, very good to talk to you. Thanks for answering all those questions, Dr. Bogosh.
Anytime.
And hey, if you've got more COVID-19 questions, you can send them in. Message us directly on Instagram at CBC The National, or send an email at covid@cbc.ca.